Hello, I'm Dr. Andrew Nash. I'm a pediatrician and Credentialed ImPACT Consultant practicing in Danville, California. I'd like to take a few minutes to talk to you about diagnosis and management of concussions in adolescents. There's been a lot of attention in the media of late regarding sports-related concussions and the long-term consequences of recurrent injuries to the brain. You may have heard that there are several class action lawsuits pending between the NFL and the Players Associations regarding the cumulative effects of multiple concussions, as many retired NFL players have a severely impaired quality of life from their injuries. A lot has been learned over the past 10 to 15 years, and as a result, how we manage these injuries has changed substantially. It is estimated that over 3 million sports-related concussions occur annually in this country. This is most likely a gross underestimation, as many of these types of injuries are either not reported or not even recognized as happening. Statistically, female athletes have more concussions than males. In fact, girls' soccer is second only to football as the sport responsible for the most concussions. There's a lot of misinformation regarding concussions, also known as minor traumatic brain injuries, or MTBIs. One misconception is that an individual must lose consciousness to have a concussion. This is absolutely not true. In fact, in most cases of MTBIs, there is no loss of consciousness. Another myth surrounding concussions is that a normal CT scan of the head excludes a diagnosis of concussion. This is also false. Occasionally, with more severe head injuries, an individual may be seen in the ER, and a CT scan may be done to rule out an intracranial bleed or skull fracture. However, in most cases of concussion, the CT scan is normal. MTBIs are not a bruise of the brain, as some believe, but rather a concussion is a metabolic derangement that follows a jarring of the brain inside the skull. In fact, in some instances of concussion, the individual may not even take a direct blow to the head. A hit to the body that jars the head and neck may transmit enough force to result in an MTBI. Once an adolescent athlete has sustained a concussion, they have a 5-fold increased risk of suffering a second one. Another confounding problem with diagnosing MTBIs in young athletes is that adolescents typically experience fewer symptoms of concussion than adults. Thus, after a significant head injury, a teen athlete may be minimally symptomatic or asymptomatic, despite the fact that their brain has sustained a trauma that puts them at risk for neurologic damage. When an adolescent does have symptoms such as dizziness or headache, they have probably suffered a greater level of trauma than an adult with the same symptomatology. This creates a bit of a diagnostic problem for both parents as well as physicians who care for these athletes. How do we determine when an athlete has sustained an MTBI? And how do we determine when they are ready to return to play? Even though an athlete may report that their symptoms are resolved, their brain may still be recovering. A key to solving this puzzle is ImPACT. ImPACT stands for Immediate Post-Concussion Assessment and Cognitive Testing. Developed at the University of Pittsburgh, this tool is a computer-based neurocognitive test that assesses reaction time, processing speed, and memory. The test is inexpensive, takes about 20 to 30 minutes to complete, and provides detailed information about an individual's cognitive functioning. Ideally, the test is administered to an athlete prior to the start of the season and repeated every 2 years as the brain continues to mature. In the event of an injury that results in a suspected concussion, the athlete in question should be immediately pulled from practice or play and closely observed over the following hours. An individual with a suspected MTBI may not return to practice or play the same day under any circumstances. Depending on the degree of injury, some MTBIs should be evaluated in an emergency room, but this is not necessarily required. California state law mandates that at most levels of play, an individual suspected of having an MTBI must be evaluated and cleared by a medical provider trained in concussion management prior to returning to practice or play. In the event that baseline impact testing has been done prior to the injury, Follow-up testing can greatly facilitate the determination of whether the athlete is impaired. When no baseline test is available, ImPACT can still be helpful. It is, of course, much more meaningful to compare an individual's post-injury cognitive ability with their own unique brain function prior to the trauma. Without a record of pre-injury functioning, a more cautious recovery plan may be prescribed. Once it's determined that the individual's subjective concussion symptoms have resolved, their exam has returned to normal, and follow-up ImPACT testing has returned to expected baseline levels, then the athlete can begin a stepwise return-to-play protocol. By utilizing ImPACT both prior to starting the season and as a helpful diagnostic tool in the event of a suspected concussion, the concussion specialist can more accurately determine the degree of injury sustained and the length of time required to fully recuperate. In this way, our adolescent athletes can be returned to play after suspected MTBIs as quickly and as safely as possible. If you have any questions or comments about the content of this video, please feel free to call or email me at the number and address on the screen. Thanks very much for listening.